My initial thoughts when I heard I was selected to be a Working for Cures champion were pure elation. I think to elevate the role of vaccines, especially in a time where there has been so much focus on vaccination over the last several years, but to elevate it across the life course and really look at the full value of vaccination and adult vaccination with our tool Vaccine Track has been a really incredible recognition, and ultimately is helping us get the word out on what we need to do to sustain what has been done from the pandemic to really raise up all immunization rates for adults. I spent a lot of time working in R&D, about a decade, on antibiotic and vaccines development. Many of the programs that I was working on for flu and RSV were seeing incredible progress, and hopefully science being able to deliver a vaccine for RSV in the next several months, which is incredible. I think a lot of the time that I spent in R&D, I started to think about the innovations that we are able to bring to light, but if we don't have the right public policies in place, those innovations can go by the wayside. So I've spent the last several years in the public policy team at GSK, and really our goal, and thinking about just the incredible context from the pandemic now, is to make sure that we are educating and elevating the vaccine conversation so that across the board we have the right policies in place, but also healthcare providers, consumers, everyone across our communities is realizing the full potential of vaccination to create healthier communities. In August, we launched a new tool called Vaccine Track. And inspired from a lot of the data that we were seeing on a daily basis during the COVID pandemic, healthcare utilization, uptake of COVID-19 vaccines, boosters, how those interventions were being deployed, we really wanted to think about how we could take that and apply it to adult immunization more broadly. So we worked with IQVIA to develop a public-facing interactive dashboard called Vaccine Track. And what it essentially does is visualizes adult vaccine claims data at the national and state levels. And we can also search and filter by certain socio-demographic characteristics like age, gender, race, ethnicity, and even payer type, so we can start to understand who's getting vaccinated, where are they getting vaccinated, and how do we think about the interventions that are needed to action the data to improve uptake of adult vaccines and ultimately create a more resilient community, healthier community, more resilient community through data to make sure that we have the highest adult immunization rates that we can. Engaging with stakeholders is critical to the work that we are trying to do to improve immunization rates in the US and elevate the role of adult vaccination in the US coming from the COVID-19 pandemic, where we saw the most successful adult vaccination program in history. We really want to make sure that those advancements are sustained so we have a more resilient public health infrastructure, a more aware and educated population across the stakeholders, whether it be healthcare providers, consumers, policymakers, payers. As GSK, we're really trying to think about our role and how we show up with these stakeholders. My name is Hashey, and I work for Cures.